Good afternoon. My name is Aura Soto. I'm doing my assignment on Unit 4, Surgical Instruments by Functions and Procedures. It's my PowerPoint. I did my presentation on the bilateral inguinal hernia repair. I picked this surgery because it looks very interesting to me. I have seen patients with this condition, but I never experienced the opportunity in being in surgery yet with them. It is a condition that is very common in small children and also in adults. The bilateral inguinal hernia repair, I took some pictures from the website. Pictures where it shows where they usually or typically they'll do the incision, how they would open it, and how they would close it or stitch it up. The signs and symptoms of having a hernia, the patients notice like small, I always say like a bag, soft bag in the inside and the lower abdominal ingroin area or in the pubic bone. You can notice this more when you're standing, when you're lifting, or when you're in bed or laying down. Okay, more also when the patient cough, you can see it. You can also have like an umbilical or hernia too. Some patient has burning sensation in the area. Some patients will require or they will want a surgery to remove the hernia and also to remove the pressure that they get with that. The hernia needs to be removed with surgery, and for this surgery normally the patient is under anesthesia. Once the patient has his or her consents for the surgery, then the physician and the team proceed with the surgery. Some of the instruments, there are many of them, but 4 of them that I found out that they use in this procedure is there's 2 knife handle. The handle for the knife or the blade number 3 is one of them. This is to create the first incision, the superficial incision. Second one that I found also that they use is a Yakower suction tip. And this is a suction tip that you use for remove any fluid or any blood, any accumulation of the fluid or blood inside once they start opening up the incision. The other instrument that I also found is the Couture clamp. The Couture clamp looks like a scissor, but it's not. It has teeth and it has 2 sharp teeth at the end, the tip. And this one is used to grasp or to hold the skin kind of forward to help the physician kind of move inside little by little. Okay, the other instrument that I found to be in the tray for this procedure is the Army Navy retractor. This is another instrument that is used to hold the skin back or to kind of to hold bones back to in one place. It's kind of interesting to see that. I saw a few videos too on how they do it. So when time comes for the surgery, the physician and his or her team will need some preparation for the surgery. The central services department makes a car or a tray instrument for the hernia repair, and then the central department will send or bring the car up to the OR for the team to use. Once there, the surgical tech gets sterilized with gowns, goggles, mask, gloves, everything, and then opens up the tray in the Mayo table or on the table, and set up all the instruments in order that it will be used. and then they're ready for the surgery. Okay, thank you.